Hey everyone, this is Dr. Zimmerman. This week we are going to be talking about concussion testing. Yes, that is right. We are going to be talking about concussion testing. So, um, whatever questions you have on that, let me know. Okay. And we're going to dive in and go through this for you. All right. So, here we go. All right. So, we are going to be talking about concussion testing. The very first thing I'm going to do is I'm going to pull up something from the University of Kansas, a research paper that they did looking at what, should be considered in concussion testing and really, you know, what are we looking at here versus what doesn't really matter. And then what we'll do is I'm going to show you what some of those tests look like, what you should be looking for when you go in, because concussions happen every single day, millions of them, right? Happen throughout the year. Many people do not get better, despite popular belief that pretty much, hey, everyone's going to recover from a concussion. That's simply not true. When they've done the research, they look at the amount of individuals diagnosed in the emergency room with a concussion. Nearly 50% of them are still not better, even 1 year down the road. And there's a lot of reasons for that, which we are going to go through some of that as well. But when you understand what happens with a proper evaluation versus what many people experience, it's going to make a lot of things make sense. So, here we go. Very first thing I want to do, though, is right, like I said, we're going to go to the research from the University of Kansas. So, I'm going to share my screen on that. So this is the University of Kansas Health System Outpatient Clinical Concussion Comprehensive Protocol. Now, this is not the official end-all be-all concussion comprehensive protocol. There are variations of this, but this is a really, really good one. So when we go here, we're going to look at the different things that they recommend as part of their testing, and I'm going to explain these. Okay. And if you've got any questions, let me know along the way. If you haven't, make sure to subscribe to this channel. And once again, I'm Dr. Zimmerman. I'm licensed both a doctor of chiropractic with a diplomate in chiropractic neurology, as well as a nurse practitioner. And I've been helping individuals with concussions for over a decade. And here is how. Now, the very first thing is we've got to look at an examination. Okay. I'm not going to go through all this, but what are some of the things that we should do? One, pre-existing things matter. So pre-existing cervical, right? So neck surgeries matter. It absolutely can impact recovery. Pre-existing mental health issues, anxiety, depression, ADHD also matters. Meclizine, which is a medication given to people for dizziness, right? Can also be an issue, right? Are there prior concussions, prior issues with blood pressure changes, heart rate changes when you change positions. Pre-existing things matter. So that's actually part of the testing you should have is a history. Okay. Now, when we go in here, we're first going to look at convergence. Okay. Near point convergence and explain what that actually is first. Now, convergence insufficiency is something that pretty commonly occurs with concussions. It doesn't occur in every concussion, but here's what it looks like. So let's say I'm being tested for convergence insufficiency. So what I do, right, is I've got something there, and you can see that's the letter E. I'm gonna hold it out, right, at a full arm's length away from a patient, and I'm gonna say, look at this. Let me know when that E first goes blurry. And then I'm going to measure it in centimeters to know how they're doing. I'm then going to keep bringing it in until it goes double. Now, sometimes they will tell you it goes double. Other times, when this is being done to you, what's going to happen is, right, it comes in and your eyes should be both going in like this. But what's going to happen, and people don't even realize it, they just know they feel weird, is instead of it going in like this, it's like, whoop, right? One of the eyes completely kicks out while the other one stays locked in. That would be a point of convergence insufficiency. This is a big issue with concussions. Now, depending on the research you look at, normal really should be 10 centimeters or less. So it's not that far. Okay. So if you imagine about the length of your pointer finger, that's what distance you should be able to see an image clear without it going double. Other research does say maybe, hey, even 5 centimeters. So convergence insufficiency is a test that anyone who's suspected of having a concussion should have evaluated. All right, let's go back to that research and look at what else should we have performed as part of a concussion evaluation. Now, let's imagine, well, I don't know if I had a concussion, but I do have a lot of neurological symptoms. Maybe it's from COVID, maybe it's from other things. Then guess what? This testing also is super important and can be highly valuable. So that was the convergence, right? Accommodation will lump in underneath that. Next, we are going to look at eye movements, okay? So there's what's called saccadic dysfunction. So what saccades is, let's say, right, I'm looking here. All right, so when we look at saccades is a rapid alternating of your eyes from one target to the next. So let's say I've got my both thumbs up here, right? I'm gonna look at one and then shift to another, go back and forth. Now, what should be measured is how long does it take you to respond? How fast do you move? And accuracy. While some of you are getting this done at the bedside, it's really best to do this using computerized technology. And I'll show you some results from computerized technology on these and other eye movements because it really is the best way of doing it. So saccades should be done. Now, if there's issues with those tasks or it even creates symptoms, then that would be a positive finding. Another test that should be done if you are possibly having a concussion is called smooth pursuits. So what happens is you're following a target that's moving left and right at different speeds, also up and down at different speeds. So I'm going to actually share with you a recording of what smooth pursuits look like. Okay. So this is a horizontal smooth pursuit where they're tracking a target that's moving left and right nice and smooth. Most people have no clue how they actually do on this test. So I'm going to share this screen with you. And let me know what you're seeing. Are the eyes moving nice and still? Are they skipping? Because most people actually have no clue how they are doing. So, all right. So the dot is moving nice and smooth. And let me know what you see. Are their eyes moving nice and still? Or are their eyes kind of skipping a little bit? Okay. And what you're going to see is if you look at this, the eyes are starting to skip more and more as the test goes on. Now, there are those that skip less, there are those that skip way more than this. Now, so smooth pursuit should always be evaluated as part of a concussion evaluation. When you have issues with this, it does create a lot of issues, including the symptoms most people deal with, right? Brain fog, fatigue, maybe dizziness, headaches, blurry vision, problems finding words, memory, and other things like that. So that's an example of a horizontal smooth pursuit. Now, what I'm going to show you is a vertical smooth pursuit. Now, once again, dots moving nice and smooth up and down. So if they're able to perform the task appropriately, their eyes should be moving up and down nice and smooth. They shouldn't be zigzagging. They shouldn't be skipping up and down. And this is another absolute essential test of a concussion. And unfortunately, if you're like most of the people I see in my office, they've never had these tests. At best, they get a little bit of hey, look at my thumb. And here's my beef with that. Okay. That is great for sidelines, but people skip different amounts. If we're trying to say you're truly getting better, if we go back and look at your videos, look at your recordings, we can show you here's where you're at, here's where you're at now. Because I don't know any provider that's going to document it exactly the same. Okay. We may use generic stuff and say, like, oh, well, their eyes are skipping, their saccadic pursuits or intrusions. But to quantify it in the way that you get in video just does not happen. All right, so here we go. Going up and down. So they should be tracking up and down nice and smooth. And what you're going to see is, right, are they going nice and smooth? No, they're not, right? They are not going nice and smooth. There's lots of skipping in here. All right, so at this point in time, we've looked at saccades. We've looked at convergence insufficiency. We have looked at smooth pursuits. Now, there's other things that we can look at beyond this, such as optokinetics, head thrust, right? And other things like that, which I'm going to spare you at this point in time. Okay. But that is what the testing should be done on that side. Next, we see a lot of balance issues as part of concussions. And when I say balance, I do not mean that you're clumsy, that you're tripping and running into stuff. Does it happen to some people? Yes. But for most people, that is not what is routinely happening. Okay. People think they're okay with their balance, but then they're not. Now, I'm going to explain why we look at balance. Okay. And why we do different tests. So when we look at balance is made up of a few different inputs to the brain. It is through your visual system, so your eyes, your vestibular system, and then the other one is called somatosensory, but I'm not going to write somatosensory out. Okay, I'm going to put joints and muscles. So the information from joints and muscles, this can be from your feet, your ankles, your knees, and your neck. So when we look at balance testing, depending on the task we're having them perform, that allows us to isolate where they are having issues. So if you've had a concussion, has your balance truly been tested? Now I'm going to walk through and show you what should be done as part of balance testing. And if you're a parent and you've got a kid who's playing sport, then guess what? Record them, right? Rip out your camera, record them before they start the season. And at least on the back end, you've got now a baseline and you know where they should be. Because this is one of the reasons people struggle to get better because they don't get good baselines. But by having a baseline, you know where you should be getting someone back to. So, what does this testing truly look like? So when we go back here to this research article from the University of Kansas for their concussion, now we do eyes open, eyes closed on a firm surface, but we also do it again on a foam pad. Okay. You can buy foam pads off Amazon or other places, depending on how nice you want, anywhere from $20 to $80. Okay. Now, there's also what's called a sharpened Romberg. So, sharpened Romberg means your feet are completely together, and that's eyes open, eyes closed. We also have a single leg stance. So, standing with one leg, okay, hands on your hips, looking straight ahead. And ultimately, this one's done with your eyes closed. And then we also do tandem stance, okay, and there's other things beyond that. So, what does this look like though from the testing that can be done in an office? So I'm going to show you what those results look like and the testing looks like that we do in our office. Now there's other forms of computerized testing, but this is one that works really well. So when we look at this, okay, we are going to see standard eyes open on a firm surface. Okay, so they are literally standing there, eyes open, feet about that far apart. How much do they move? And if you're wondering, there's a before and after. So what you see on the top is how much they moved initially versus after treatment. And then we have proprioception. So proprioception is with eyes closed. So eyes closed on a firm surface is mostly challenging your joints and muscles. Then we go to the blue pad. Once we go to blue pad, we see vision. So it tells us when we looked at what happens with a balance, right? We said balance is visual, vestibular, joints and muscles all working together. But when we have you do the vision side, that is eyes open on the blue pad. We are challenging that more than anything else. Now, everything is truly going to be challenged, but it's which way is it skewed or biased? And the last one is the most important one for concussion evaluation. Once again, this is the most important one for a concussion evaluation, and it is the vestibular function. So it's how do you do when we remove your vision, we mess with the information coming from your joints and muscles because you're on a blue pad, and you close your eyes. This is the one that is known in concussions that when the brain's not as healthy, when you stand on this, you move a lot more than you should. So, for example, this individual moved nearly 4 times as much by closing their eyes on that blue pad than they did with their eyes open. But after treatment, what did we see? That 157 reduced all the way down to 71. So they more than half their score. And they went from a second percentile for their age to the 49th percentile. So this is a super important test. Now, up to this point in time, we've talked about different tests that should be done. We've talked about all the visual stuff, right? Convergence, insufficiency, saccades, pursuits. You should even do gaze fixation, so your ability to keep your eyes still on stationary targets. We've talked about balance testing, eyes open, eyes closed, firm surface, balance pad. Now, these are things that should be done with every single concussion. It doesn't matter if you're like, but I don't have blurry vision, or, oh, I think my balance is good. Guess what? It should be done. Now, what is one of the most common things that people are getting done or they're pushing to get done with a concussion that shouldn't be pushed? What is it? What do you think the answer is to that? If you got an answer, type it in. But what is it? MRI and CT scans. I'm going to stay with the red because that looks fine. Okay. CT scans and MRIs are routinely pushed, especially when people go to the emergency room, like, hey, I need a scan, I need a scan, I need a scan. Or if people still aren't getting better 6 months down the road, they also push for the scans. But what is the purpose of a scan from a CT and an MRI perspective? What is it? It is to rule out something beyond a concussion. right? Was there a brain bleed? Was there a fracture? Because the standard MRI, CT scan that you get in the majority of hospitals is not capable of picking up a concussion. Now, maybe you are in a place where you're able to get advanced imaging like DTIs, diffusion tensor imaging. Maybe you spend the extra money and you get a functional MRI, some of these things that can show some concussions, but not all, right? Those can do it to an extent. But if you go and you get a standard MRI, standard CT scan, it is not going to show a concussion. And just because you have that scan and you're told it's normal does not mean that things are normal. Okay. It does not mean that you're crazy and that there's no reason for your headaches, your blurry vision, your light sensitivity, your mood changes, your fatigue, your concentration, your word finding, your memory, right? And all those symptoms that people experience on a daily basis and continue with a concussion. And this is why it's so important to get proper concussion testing. So I trust this helped you understand better what you should be looking for with concussion testing, specifically eye movement function, balance, and also understanding the limitations that imaging offers in the world of concussion. Once again, I'm Dr. Zimmerman. I'm licensed both a doctor of chiropractic, a diplomate in chiropractic neurology. I'm a nurse practitioner, and I've been helping people for over a decade now recover from concussions, even though they've been to many other clinics. So comment and make sure to subscribe because that's the only way this YouTube channel keeps growing and I keep putting out videos like this. Until next time, this is Dr. Z.